Hello, everyone. My name is Gurja Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I'm very pleased to welcome everyone to the third and final day of Lymphoma Canada's National Patient and Caregiver Conference. Our first session of the day is a panel discussion titled Multidisciplinary Management of Lymphoma and CLL. We have a lovely facilitator with us today. Her name is Sabina, and she will be prompting questions to our panelists and leading today's conversation. So just to introduce our facilitator, Sabina has a Master's of Science in Clinical Pharmacology and Toxicology and is currently a Doctor of Public Health candidate at the Dalla Lana School of Public Health. Sabina has been involved with Lymphoma Canada for nearly a decade, first as a volunteer and then as a board member for over 6 years. She's also the co-founder of the Vora Miller Foundation. So thank you everyone for joining us today, and I'll pass the presentation over to Sabina now to introduce the panelists.
Thanks so much, Gurjot. Hi, everyone. Thanks for joining us here today. This is actually going to be my 7th year moderating this multidisciplinary panel at our annual conference. So even though I stepped off the board earlier this year when I was asked to continue moderating this panel, I was absolutely thrilled. From previous years, I can tell you that the discussions that we have here are incredibly insightful, and the open dialogues between different members of your care team brings this immense wealth of knowledge, a full spectrum, holistic approach to care. And that, in my opinion, is absolutely incredible to do, which is why I love moderating this panel year after year. So with that, let's begin. I would first love to introduce our panelists for this year. We will begin with our physician panelist. It's Dr. David McDonald. Dr. McDonald is a hematologist at the Ottawa Hospital and assistant professor in the Department of Medicine at the University of Ottawa. I'm so used to saying University of Toronto myself, and so I had to put that in. Little plug. He received his MD at Queen's University and did residencies in internal medicine and hematology at Dalhousie University. He then did a clinical trials fellowship at the National Cancer Institute of Canada Clinical Trials Group, then a clinical lymphoma fellowship at the BC Cancer Agency in Vancouver. He was chair of the hematology cancer site team for Cancer Care in Nova Scotia for 10 years before moving to Ottawa in 2017. He's a member of the Scientific Advisory Board for Lymphoma Canada as well. His clinical and research interests are in clinical trials of novel therapies in lymphoma and CLL. Thanks for being here with us today, Dr. McDonald.
Thanks for having me.
Next, we have our nurse, Sarah Nadeau. Sarah Nadeau is a nurse practitioner working in complex hematology at the Saskatoon Cancer Centre. She received her Master's of Nursing nurse practitioner from the University of Saskatchewan in 2022. Her areas of practice include CAR-T, non-Hodgkin's lymphoma, CLL, and allogenic stem cell transplant long-term follow-up. Thanks for being here with us today, Sarah. Next, we have our social worker, Renee Wishart. Renee has been with BC Cancer Vancouver Centre since 2017 in the role of counselor. Specifically, Renee works with patients who have been diagnosed with blood cancers and lung cancer. Through this role, she's been able to provide one-to-one counseling, family counseling, and has facilitated both supportive and psychoeducational groups for patients. Renee works with multidisciplinary teams to provide both outpatient and inpatient support. Thanks for being here today, Renee. And finally, we have with us here today, Jean Lamantia, who is a Hodgkin's lymphoma cancer survivor, and as well, in addition to that, also a registered dietitian. Jean uses her personal experience and training in clinical nutrition to help others at every stage of their cancer experience. She's written 3 books, writes a popular blog, and hosts webinars and classes for people with cancer, lymphedema, as well as lipedema. I've actually scrolled through your blog, Jean, and it's absolutely a wonderful resource. And so I'm going to throw the link in the chat so that any of our attendees who are here would like to check it out. Please do. I highly recommend it.
Thank you. I appreciate that.
Thanks so much for being here with us today, Jean.
My pleasure.
Okay. So I will throw that link in chat in just a second, but before I do that, I just do want to give a quick introduction of what our panel is going to be about this year. It's very similar in terms of concept and topics that we've talked about in earlier years. And so diving at today's topic, it's the multidisciplinary care we know is extremely essential for lymphoma patients as it brings together a team of specialists, as we see over here on our panel today, each contributing their expertise to provide comprehensive support. This collaborative approach ensures that all aspects of a patient's health are addressed, from medical treatment and symptom management to emotional well-being and nutritional needs. By fostering communication amongst healthcare providers, multidisciplinary care enhances treatment outcomes, promotes patient empowerment, and ensures that patients receive personalized care tailored to their unique circumstances. Ultimately, this holistic model leads to a more supportive and effective treatment journey for those affected by lymphoma. And so building on this topic of multidisciplinary care, this year our session will highlight 4 themes. It's going to be navigating treatment options and side effects, emotional and psychological well-being, nutrition and lifestyle, as well as patient advocacy and support. So we're going to go through all of these 4 themes. And so let's start. We're going to start with our first theme, navigating treatment options and treatment side effects. And my first question is going to be for you, Dr. McDonald. In practice, could you explain what multidisciplinary care looks like and the importance of personalized treatment plans for lymphoma patients?
Sure. Thanks, Sabina. And thanks for putting me first, but I'm going to just sort of clarify that I don't think that I could explain multidisciplinary care any better than you just did. I think it really is a concept that looks at all aspects of a patient's care, not just, what is the best treatment for, Hodgkin lymphoma or CLL or diffuse large B-cell lymphoma, not what are the ways that we manage nausea and diarrhea and other side effects of chemotherapy, but it's looking at the whole patient experience, from, physical, emotional, and as you've described, you've mentioned all the members of the team. So the multidisciplinary team includes the physician, and includes the nurse that's in the clinic. It includes the pharmacist that's in the medical daycare unit that's delivering the chemotherapy. It includes a social worker in the background, possibly a physiotherapist, possibly a nutritionist. All of these disciplines that provide care really have an important role to play. And I think, over this hour, I probably should be the one that was introduced last and the one that has the least to say, because my area of expertise is very focused. And there's no way that I could provide competent care without having that entire multidisciplinary team around me. I think the question of the importance of personalized treatment plans, that's a very separate issue, and I'm glad that we're talking about that today. Personalized treatment plans and patient participation in treatment decision making, I think, is something that we now recognize as extremely important, both from a practical perspective, in terms of respect for the person, but also in terms of cancer outcomes, because I think, we talk about the relationship between a patient and a care team, or, in some circumstances, somebody will refer to a patient as a client, and I think that has a very different connotation. But the satisfaction that a person experiences with their cancer journey and their cancer treatment really requires that they are involved in a two-way or a multi-way discussion and decision process about treatment decisions. There are circumstances where we all have bias, right? As a physician, I certainly have bias that takes into account medical data, clinical trial data, and all of the information that I've been trained over 25 years to know and to believe that I understand. So I have to also respect that the person in front of me also has their own bias, and that sometimes, not sometimes, always, their bias is just as important as mine. So keeping things as open as possible, having discussions, in a circumstance where somebody has a cancer where there is one treatment and one treatment only, you think, well, how is decision making a part of that? It's either you take the treatment or you don't. But that's not exactly it, right? Somebody who, for example, needs to get R-CHOP for diffuse large B-cell lymphoma, that's not just chemotherapy administered one day every 3 weeks. It's all of the care that goes around that, and there's plenty of decision making that goes into that. So I'm not sure if I did a good job of answering the question, but certainly I can't stress enough the importance of personalized treatment decision making, personalized treatment plans.
No, absolutely did, Dr. McDonald. Maybe I could just touch upon a little and follow up with a follow-up question on that, because it's actually a question that we received many times. In fact, yesterday I was moderating another panel and this question came up over there as well. But very often you do see that, there are multiple treatment options available for patients. And this question comes up very often from a patient is what do we do when there are multiple treatment options available? And so maybe I could get you to expand a little. You've already sort of talked a little about involving patients in that decision-making process, but perhaps you could just expand a little on how do you approach when there are multiple decision or treatment decisions that are available, and how do you actually involve the patient in that decision-making process regarding all of their options?
Okay, that's actually a very topical question. It comes up every day. I was in the clinic this morning, and with me in the clinic was a senior hematology resident, somebody who's been in training for 6 years, and we had a patient with CLL who was faced with a decision about a choice between two very different options in terms of the treatment of CLL, and each of those options are well based in the scientific data for how well they work, but each option has both very different risks of particular side effects or the specific side effects to that option. And also each treatment has a different impact on a patient's lifestyle, right? The requirement to travel to the center, the requirement to have frequent blood work, the requirement to be monitored very closely to watch for specific blood abnormalities, in one treatment option versus the other option where, it's a prescription of a pill that the patient takes at home and it's extremely convenient, but there may be other aspects of the side effect profile. I talked with this resident about the fact that, I think I can present two options to an individual, and I can, like I said before, I can bias how I present those two options to make one option look like the best option in the world for anybody, and the other option to be a very non-desirable option. And what I have to recognize is that I do have my own bias, but my bias isn't the most important thing in the room. What's most important is what's important to that patient, and that patient it would be presumptuous for me to assume what aspects of those two options would be most important to the patient. So what I do is I provide the two options with as much information and detail in as non-biased a way as I can, and I try to guide the discussion so that what's important to the patient is brought out into the discussion so that I'm aware of where they're coming from. And also, I've looked after a lot of patients. I've seen a lot of people go through each of those two types of treatments. And so I do have some personal experience that I think provides value to the discussion. So we try to present the options. We try to present them as balanced as we can. And oftentimes it's a simple discussion, and the patient may say, well, what is the best thing for me, right? And then that puts a lot of responsibility onto me, both to present what I think is the best option, but also to make judgments about what I think would be best for that individual. That's sort of old-fashioned medicine, right? I practiced 15 years ago, and we didn't have these types of discussions. It was, this is the guideline. The guideline says treatment X is the best treatment for you at this time point, and we didn't provide, treatment Y. We didn't talk about the other options. That's no longer the case, and it's not so comfortable for me to be put in a position where somebody may say to me, well, if I was your mother, what would you recommend for me, or what would you want me to have? My response to that is, really, you're not my mother. You're different than my mother, and I need to know more about you because I need to help you to make the decision that's best for you.
It's amazing. I think that really is, in a nutshell, personalized care. So thank you for taking us through that. Sarah, maybe I could get you to expand, from your perspective, what role do nurses play in helping patients understand their treatment options and potential outcomes?
Yeah, thank you for that question. I do think the most important role that nurses play is in that of educator. So I think for a lot of patients, there's a ton to learn when they're faced with a new diagnosis, in terms of staging and treatment options and prognosis and, options for the future. And so it can be very easy to do a quick Google search and find a ton of information online, but that doesn't necessarily apply to patients in their unique situations. And so I think one thing that nurses do really well is kind of approaching their patients through a very holistic lens and looking at their cancer diagnosis beyond the medical piece and looking at things like emotional well-being and fears and social aspects and work and money and all of these things, and kind of putting that piece together so that they can actually deliver information that's appropriate to patients in their unique situation and where they're at. And so, I mean, I am a nurse practitioner now, but I was an oncology nurse before. And I think across the board, what nurses do really well is meeting their patients where they are at and making sure that they're giving teaching and information that's actually appropriate for your individual situation.
It's amazing. And on that theme of teaching and educating patients, could you perhaps discuss with us or share with us how your team communicates about possible side effects of new therapies to ensure that your patients are fully informed?
Yeah, I think it's important to recognize that everyone learns differently. So teaching up front from their doctor is very important, but then people are going to need to hear things multiple times, whether that's through, webinars like this or through videos or written information. So I think nurses are very well suited to kind of put all the pieces together and deliver that information through different medias. The other thing I think that nurses are really important for is being that really essential lifeline between the patient and their oncologist. It's always difficult to reach your oncologist in a crisis, but the nurses tend to be more accessible. So I think one thing the nurses can do is do those assessments, gather the information, and then relay that to their oncologist so that we can come up with a plan together. And again, using that kind of holistic approach.
Amazing. Yeah, the collaborative care really is the foundation of good care. So thank you so much for taking us through that, Sarah. I'm going to switch over slightly topics, Renee, for you. I want to know from a social worker perspective, how do social workers contribute to the care team for lymphoma patients? If you could take our attendees through that, that would be so helpful as well.
Certainly, yeah. And thank you. So it's again, as we've kind of stated multiple times here, it's very much a multidisciplinary team working with each patient. So the way BC Cancer Vancouver works is that we do work together to see what we can do to support the patient and their individual needs. So with social work, social work historically and currently, we deal with the practical concerns in regard to financial stressors, accommodation, travel, maybe prescription costs, all those kinds of things when it comes to being treated. But my role as counselor, we also provide individual family therapy around adjusting to the diagnosis, adjusting to the treatment, and the post-treatment, what goes on there.
That's great. And, I want to come back to the topic of side effects because it's one of those things that comes up in conversations very often. Could you tell us from your perspective, what resources do you provide to help patients cope with the physical impacts of their side effects?
Well, to be honest with you, I wouldn't deal with a lot of the physical aspects of side effects. We do, in my department, have a great deal of support in the way of mindfulness and meditation. Mindfulness-based stress reduction is what we use to help patients cope with whatever it is that they're feeling or what effects they're dealing with. But in the way of more physical demonstrations of side effects, we would refer probably to the MRP, a nurse, or somebody, physio maybe.
And I think that's, again, highlighting the fact that we do need to have that collaborative environment and tap into our colleagues and resources that can provide that whole person care to our patients. So thanks again for taking, and I actually do want to talk to you about the emotional and psychological aspects and resources that you are able to provide, Renee, but maybe we'll save that for our next section so we can really focus on it. Lastly, Jean, I'm going to come to you. I read your blog and I absolutely love it. And I think I would love for you, reflecting on your patient experience yourself, what type of supports were available to you when you were making decisions about your treatment plan? And how did these resources help you manage your symptoms and side effects?
Well, my treatment was 30 years ago. So I was diagnosed when I was 27. I'm now 57. I don't recall too much of resources being available. I just remember, and by the time I actually got into the hospital, got through all my staging, I was really in very critical situation. I had to be admitted to the hospital, and my chemo had to be started even before my staging was complete. I don't remember too much about making decisions about the treatment plan. It was more, this is the treatment. We're starting tomorrow. Get ready, buckle up. But I do remember, being referred to Dr. Mary Vachon, who she was a nurse, but has essentially functioned as a psychologist or social worker. And so I remember accessing that resource and that being very helpful in, a young adult, coming to terms with such a critical diagnosis. And as well, at that time, they had primary care nurses that were assigned to each oncologist. So I really appreciated that model because I felt like the nurse maybe had a little bit more time to sit with me and explain things. And also the pharmacist. She was young and I was young, and I think we sort of clicked, and she was a great resource to me as well. But, it was kind of one treatment, and it's either take it or don't take it. And so I don't recall a whole lot of discussion around that aspect. I was ready.
I think,
Let's just get going here.
yeah, and I think that, again, rounds up our conversation, how we started with Dr. McDonald talking about how, he would practice earlier 15 years ago, and how things have shifted now with respect to a lot more involvement of the patient in decision-making as well. So I think we are moving in the right direction now, involving patients in these decisions and discussions as well. Okay, so I want to switch theme to our next theme, and this is going to be, our next theme is going to be on the emotional and psychological well-being. So Renee, I'm going to start with you because I have that pressing question from our last conversations, but if you could perhaps start with us and tell us, what emotional challenges do patients commonly face during their lymphoma journey, and how do you as a social worker provide support to them to navigate these challenges?
So I do want to say that it depends on the patient. Again, it's very individualized. It has to do with age. It has to do with supports. It has to do with what stage of life or part of life that person is currently in, and the help that they require at that time. But overall, what I can say based on, the counseling sessions that I've done with patients who have a blood cancer is there's a sense of helplessness, a loss of control. The adjustment to the diagnosis itself is quite shocking, right? So that takes some time. The adjustment to the treatment process is also something that patients have a really hard time with, because the urgency of trying to get it done and the medical system the way it is, it's sometimes not possible to do it right now, everything happening all the time, right? Also, there's a lot of, like I discussed, post-treatment concerns, this idea that you're supposed to have a new lease on life, when in fact, you're just kind of coming to terms with the fact that you were even diagnosed. Because oftentimes people, when they first get diagnosed, go into that fight, flight, freeze state, right? And stay there until they're done. So in my department, we deal with a lot of fear, anxiety, and depression. We're really lucky at BC Cancer to have a psychiatry department. If any of those, I guess, emotions kind of turn into more of a clinical situation. But for general purposes, we tend to, like I said, use mindfulness and meditation as a way to address what the patient's going through. We have wonderful groups that we have dedicated to the reduction of stress, particularly. So there's a relaxation and music therapy group. The art therapist is able to support the younger population through art therapy groups. There's also groups that are designed for children of patients with cancer. So there's lots of kind of discussion around how to cope and how to manage with what you're dealing with. Also, some of us have been trained in calm therapy, which is managing cancer and living meaningfully with the patients who are coming towards unfortunately, end of life situations. We've also been trained in CBT, and we also tend to come from a strengths-based perspective with what patients can do. That sense of loss of control is really prominent. So it's kind of thinking about what can we do to support you with what you do have and what you can do. Also patients, sometimes we encourage them to refer to a support team as much as possible. If there's something going on with your eating, we refer to dietitians. If there's something going on with your mobility, we refer to physio. And if nothing else, we look around for community support if there's something that might be available to each individual and what their needs are.
Yeah, it's amazing. So meeting people where they are and figuring out what their needs are and working on that is just absolutely incredible. I also want to touch a little and ask you about family counseling, because that also comes up very often in our conversations. What are the benefits of family counseling for patients dealing with lymphoma, and how can families best support their loved ones, through their treatment journey?
Yeah, so this is a great question. My department's called Patient and Family Counseling, specifically because there's been lots of research around what happens for the caregiver of the patient, right? So the way in which treatment is delivered is kind of, you get it, whether it's an inpatient or outpatient, but then you tend to go home for recovery until the next treatment, right? So whoever's at home is kind of the person who's trying to manage what goes on there, which can be really frightening. So family therapy offers the opportunity for the family to discuss what it has been for each member to kind of get this news about the diagnosis, how they're navigating it, and how best to support the patient. Each patient, each person is different. If you think about the common cold, some people want all the things and all the company and all the soups and all the friends and all the calls, while others want nothing, right? They just want to get better and then to leave them alone. So it's really an opportunity for the patient to discuss what they feel would be best for them at that time, and for the family to start to get comfortable with discussing the diagnosis itself, since it's such a scary thing. People oftentimes have a hard time even saying cancer. So it's a good thing to have this opportunity to discuss what goes on together. It's also giving the patient time and the family time to reflect on the ways in which they all need support and how best to get it, either from each other or from people like myself or all of the panelists here.
That's amazing. Thank you so much for taking us through that. Jean, I'm going to turn it over to you, and I'm going to ask you, as a Hodgkin's lymphoma survivor, can you share your experience with the emotional aspects of your journey, and what support did you find that was most helpful during that time and also later?
Yeah, there's really two distinct phases there. One was that diagnosis phase where I was really dealing with really just a crisis of faith, and it just, struggling to reconcile. I thought, I had caused this, I had done some terrible thing, and God was punishing me. And it was really just, it rocked my whole belief system. And so I was in my hospital room, and my aunt called me, and I burst out crying, and the nurse who had come in noticed that, and she made a referral to Dr. Mary Vachon. And so that was at the beginning of the journey, and that, that helped me. And then, that was 6 months of chemotherapy after that, another month of radiation. And then I was at a different stage, and, people who are listening who've been through this will understand, how crazy this was. But as I was driving to my last radiation appointment, I had this picture in my mind, and that was when it finished and the big lead door opened and I came out. I thought my radiation oncologist was going to be there. He was going to shake my hand, and he was going to say, "Congratulations, Jean, you did it, you're cured." So this is the vision that I had in my mind when I drove there. So you can imagine my disappointment when I came out and he's nowhere to be found. The radiation techs, they just called the next patient, and that was it. I got an appointment, and I was very disappointed. And I remember thinking, oh, at the follow-up, like, he's too busy to come down at the follow-up, that's when he's going to tell me I'm cured and everything worked. So again, set myself up for another letdown because I go to the next appointment with that expectation in my mind. He, X-ray, blood work, checks me out and says, okay, we'll see you in 3 months. I'm like, wait a minute. Like it took me a while to clue in. And then 3 months later, again, same thing. And then finally I realized, oh my gosh, this is my life now. This is my, leave those appointments feeling relieved. Oh my gosh, it hasn't come back. I'm okay. And then a gradual buildup of that anxiety and fear as I go back, thinking, oh my God, if it wasn't there last time, it could be there this time, because that's why they scheduled these 3 months apart. And I was a nervous wreck. And finally, I went out with some friends and I had some alcohol. And this was my first alcohol since I started this whole thing. And one thing, like months and months before I was diagnosed, one thing I would notice about my lymphoma was that it felt like a stiff neck, but if I had alcohol, the pain would radiate down my arm into my hand. And it wasn't until after I was diagnosed and, I was reading in some medical textbooks, it said Hodgkin's lymphoma sometimes reacts to alcohol. I'm like, that's what that was. That's what that was, like all those months ago. And so now here I am, I'm post-diagnosis, post-treatment, I'm having my first alcohol and I get a headache. And oh my gosh, it's gone to my brain. I have mets to my brain. And I was in a total panic. So I called the cancer center where I had my treatment and I said, you have to page the oncology resident on call, because I was too afraid to, ask for the actual oncologist. So I asked for the resident and they got on the phone and I said, I'm a Hodgkin's patient. I finished my treatment. I had my first alcohol. Now I have a headache. I think I have brain mets. And he laughed at me. And it was so humiliating. And then I could hear myself explaining, oh, you don't understand. Like, this is how it was first manifested. And, the alcohol reacted. And he said, you don't have brain mets. You're just hungover. And essentially that was the end of the call. But this little voice in my head was like, Jean, you have got to get a grip. Like, I was just so hyper vigilant, so fearful. And I thought, you can figure this out, because at that time I was already a dietitian. So I had done my 4-year honors degree in human nutrition. I'd done a clinical dietetic internship at the Toronto Western. I'd worked a little bit. And so I thought, like, just turn up the nerd volume and get reading some research. And so that's what I did. Like, I really started reading a lot of the nutrition research. Because when I asked my oncologist, what can I do here? Because I realized they're experts at detecting the cancer, experts at treating the cancer, but I wasn't getting anything in terms of prevention or risk reduction. And so I really felt like I was on my own for that. And so when my doctor said, just eat a healthy diet, that didn't actually reduce my anxiety, because all I pictured there was, Canada's Food Guide. But Canada's Food Guide, because I had studied this in like second-year nutrition class, that's for the general public. It's a public health tool for otherwise healthy people to remain healthy. It's not a tool specialized for people who've had cancer treatment, who I felt like had specialized needs. So I just kept reading everything I could read. And what I found was that the risk reduction strategies all seemed to come under one of 3 categories. And it was either the nutrition that supported the immune system. And we know that the immune system can detect, individual cancer cells. The second was that it reduced chronic inflammation. And inflammation you can think of as an environment inside the body. And it's an environment that cancer cells really like. But we know that diet can actually change that environment. And thirdly, from the laboratory research, we know when, scientists are working with cancer cells in the laboratory and they're introducing extract of, broccoli or green tea or soy or pomegranate or, turmeric, that can interrupt that cancer life cycle. So I really started, doing more of those things. And it just gave me this mental checklist. Okay, have I had my green tea? Check. Have I had my fruits? Yes. Have I had my broccoli? Yes. And it felt like, okay, now I actually have some things that, because I've read the research, I've seen what it can do, that actually is what started to reduce my anxiety and you know what Renee talked about, like taking back that control piece that you surrender. And actually, as it came sort of full circle, I ended up creating what I call, you know, the Cancer Risk Reduction Guide, which is sort of my version of Canada's Food Guide, but specially designed for people who have had cancer, any type of cancer. So, yeah,
Thank you
that
so
felt
much
really
for
good.
taking us through that journey. I do have questions for you on that. So I think I'm going to save it for the next section on nutrition, but thank you for taking us onto how, you know, your work in nutrition actually manifested with respect to the new guide that you created. But I want to just switch gears now. Sarah, I'm going to come to you and ask you, how does the nursing team contribute to addressing patients' emotional needs alongside their physical care? As we know, you know, from Jean's example as well, that it was a nurse who actually saw her crying, referred her, but could you maybe expand on, you know, what the role of the nursing team would be in this?
Yeah, of course. So I kind of mentioned earlier, nursing training is very big on holistic care. So again, really looking at people from multiple angles, including everything beyond the medical diagnosis. And so I think one of the things that nurses are helpful with when it comes to the emotional side of cancer treatment and diagnosis is really looking at how all of those other aspects, emotional, psychological, social things, play into how you cope with physical side effects. So we have medicines to treat nausea, we have medicines to treat diarrhea, neuropathy, and all of these things. But your ability to deal with those things really varies depending on where you're at from an emotional and psychological state. So I think nurses are really good at putting those pieces together. They might not be the best at the counseling piece because we don't always have the most time. Although I do think we have a little more time than our physician colleagues to explore these things, but we are able to make connections with like our social work colleagues like Renee, to make sure that once we've identified a problem with coping and stress and all of these things, that we can get you connected to the people that can really help you work through some of those complicated, you know, feelings and emotions. Yeah, and like I said before, I think we're all stretched in the healthcare system. No one has a ton of time, but nurses do have a little bit more time to really sit down and listen to where you're at with things and what might be contributing to some of the negative physical side effects that you're experiencing.
And just to follow up on, you know, your last point about listening to patients, perhaps you could share with us what strategies you can suggest for patients to effectively communicate what their emotional needs are.
Yeah, I like to think that most people are at least a little bit like me. And so I'm a person who, if I have a thought or a question in my mind, when I go to my doctor's appointment, I will immediately forget it. And then I'll go home and remember it after the fact. So the biggest piece of advice that I give to folks when they're diagnosed is to keep a cancer journal and just have one source, one journal where they can write down all their questions, write down their symptoms so that they don't feel like they're forgetting things at their appointments. You're a lot less likely to forget if you put some of these things outside of your physical brain and onto your paper brain. The other strategy that I like to recommend to people is that obviously exploring your emotions and your fears around all of this can feel very vulnerable. And that's not something that we have a lot of practice with in our everyday life. So it's very much a muscle that you have to get into the habit of flexing, practicing being vulnerable, practicing exploring these things that are difficult to think about. And then the final piece of advice that I give our patients is to make sure that they bring someone with them. Again, that comes into vulnerability a little bit, but we know that you may remember 30% of what we tell you in a visit. So if you have another person, they might remember an extra 30%. The more brains that are in that visit, the more things you're going to remember. And it's also helpful to have someone who knows you and who loves you be able to help you express some of these challenging things.
And they're with you all the time, so they see a lot more as well. So that's you know, some very, very solid strategies. Thank you so much for sharing those with us, Sarah. Dr. McDonald, I'm going to head over to you and ask you, from your perspective as a hematologist, what do you think is the impact of mental health on treatment outcomes? Is there an impact? And if so, does your team address that with patients?
Yeah, thank you, Sabina. And first, I want to thank Jean for sharing your story, because I think it really highlights something for me, relevant to this question, and that is that, there probably isn't a cancer survivor out there who hasn't gone through something similar. And I think, from my perspective as the physician, when a patient comes for those follow-up visits every 3 months in the first year or two, there's a lot of putting on a brave face for the doctor, right? And a lot of hiding that fear for whatever reason. It may be because it's considered to be, socially unacceptable to show weakness or show vulnerability. I don't know what's behind that. Maybe it's, a sort of a denial. If I don't let the doctor know that I have these fears, then somehow they won't be there, right? I think we've all lived a shared experience in the last 4 years with the pandemic. And it really, for me as a physician, but more so as a person, as a human, it's really brought the importance of mental health to the fore for me. We've all experienced social isolation, and particularly cancer survivors, people who have gone through treatment, they've had their immune systems compromised, and therefore the fear of being out there in public and that isolation has really had quite a profound impact on those people. And I see it in my own life. My children who, were in grade school and in high school and lost opportunities and had to be socially isolated, they also had a mental health impact, and so that's really hit home. What do I do? In those follow-up visits every 3 months, I can understand that radiation oncologist, your visits with the doctor, and he's not celebrating your victory at each visit, right? It's blood work, check, lymph node exam, check, symptoms, check. But for me, the fourth check is really just get through those three things and then say, how are you doing, right? This is a disease for you in particular, Jean, a disease that's a curable disease, right? And isn't it awful to consider that somebody might go through that 6 months of torture with that treatment that they had no option about, and it had all the awful side effects and so on. Now they're in remission, their doctor forgets to celebrate that with them, and their quality of life is impaired because they live in fear. I'm not going to take that drink, because what if I take that drink and I get that pain down my arm? I'll panic. So I think it's important for me as a physician to address that in the room and say, yeah, just as important as examining your lymph nodes is asking you the question, how are you doing? Are you back to work? How are your relationships with your family? Is everything getting back to normal? Because it's time for you to move on to that next phase.
Thank you so much. That was really, really a well-rounded conversation amongst all of our panel members on this incredibly important topic. So thank you for adding in all of your individual incredible perspectives on it. I also just wanted to let our attendees and participants know that Lymphoma Canada also has a monthly support group and a one-on-one peer mentorship program for both patients as well as caregivers. And I'm going to ask if Gurjot could possibly put that link in our chat for attendees, so you have that resource on hand as well. Switching to our next theme, we're going to talk a little about nutrition and lifestyle. And of course, Jean, I'm going to come to you first. We heard a little about it in our previous section, but I would love for you to expand a little more on it, and perhaps take our attendees and on how do you approach nutrition specifically for lymphoma patients, whether they are in treatment or they're in recovery, and do your recommendations change, for patients who are currently in treatment or those who are in remission?
Yeah, you hit on my favorite subject now. You're going to have to cut me off because I can talk about this for hours. But to answer your question, absolutely yes. My treatment strategies, my nutrition recommendations vary when someone's in treatment versus post-treatment. And I'll use myself as an example again. So I had my chemo. Oh my gosh, I had so much nausea, so much vomiting. Was terrible. And I go on. I hear nutrition experts talking and say, oh, if you have cancer, you have to get all of these antioxidants. You have to eat this and that. And I'm thinking, oh my gosh, if someone had told me that when I was in my treatment, I would not have been able to do it. And I would have just felt guilty, and I would have been, saying, what are you doing? Well, you can't eat this thing. And all I could get down were comfort foods. That was it. Like, so absolutely, I do not put pressure on any of my clients like that. Like, they're already, kind of feeling guilty about everything they eat and overthinking everything. And see, I went through cancer treatment pre-internet. And so what happens now is people are so confused of all the contradictory information, and they come to me just overwhelmed. I don't know, can I have seed oils? Can I have dairy? Can I have red meat? Right? And so they do have a lot of anxiety around that. So I help to calm that down. But absolutely, we're dealing with treatment side effects. And if you see this book behind me here, that's all about treatment side effects. What to eat if you have nausea, if you have mouth sores, if you have dry mouth, if you have taste changes, if you have diarrhea, constipation, if you have anemia, everything, because there's a nutrition strategy for all of those things, which can help complement some of the medical care that you're getting. So that is job one, deal with side effects. Now, either they're finished with treatment or they're getting through their treatment with not too many side effects. That's when I would talk about those 3 keys to cancer risk reduction, and make sure that their diet is anti-inflammatory, that it's supportive of their immune system, that it contains all those nutraceuticals that we know from the laboratory scientists can like get at that cancer cell. And this is the part where, they're taking back that control. They're like, I can eat that. I can do that. Yeah, I can change that around, or, I can balance my plate in a different way, or I can add more herbs and spices. And it's just doable. And it just helps with 2 things. It helps you feel better, right? Physically, but it also helps mentally, because, as I like to say, you feel better because of what you're eating, and you feel better about what you're eating, right? And a lot of what I do is also just explaining why you should do something. And I had a class today that I taught, and someone said, "Oh, Jean, thank you so much for not just telling us what to eat, but explaining why," right? There's always a story. For me, every piece of research I read is a story. I just have to tell it, and in a way that you understand and you get it. He's like, I understand now why you want me to eat that broccoli, and why you want me to steam it for 3 to 5 minutes, or why you want me to drink that ginger tea, or etc. And yeah, it's can be very, very liberating to just have some things that you can do for yourself to help you.
Thank you so much for taking us through that. And so if you could give us a very quick short answer with respect to what practical steps can lymphoma patients take right now to improve their nutrition and overall health, what would be, the first thing that comes to your mind?
Right. And just to clarify, we don't have a lot of specific nutrition and lymphoma research. But what we're going to do is I borrow research from other cancers, because they seem to be a little bit more studied in the nutrition space. But what we know from like all cancers, if we sort of pool all that data, is that fruits and vegetables are very powerful, because our nutraceuticals, and that comes from 2 words, nutra, so that we take that from nutrition, and ceutical comes from pharmaceutical. So these are nutrients that are in our foods that have pharmaceutical effects. Okay, so the nutraceuticals, it's in plants. So it's in fruits, vegetables, grains, legumes, and herbs and spices. So getting that to be the majority of your plate. And often that's called a whole food plant-based diet, or a plant-based diet. And I tend to use those words versus, vegan or vegetarian, because not that there's anything wrong with that, but that to me is more about what's not on your plate, right? Because a vegan, for example, could eat French fries and a Coke, right? But what you want to focus on is the plants, and getting the plants on the plate. So that's number 1. The other thing with a lot of cancers, we don't have, again, a lot of research on lymphoma, but limiting alcohol, limiting red meat, but especially processed meat. So processed meat would be meat that it is processed with nitrate, so nitrate preservative. So if you look on any package of bacon, I'm sorry to break that to you if people are loving their bacon, or their cold cuts or sausages, you see sodium nitrate, that means that's processed meat. And so that we want to minimize, but focus on filling that plate up with plants. And then fish is excellent because it's rich in, most fish, or some fishes are rich in omega-3, which is the strongest anti-inflammatory in your diet. And
I think
plant
we
proteins.
might
Yeah,
have to actually probably move to our next question. Sorry to interrupt you,
absolutely.
Jean, but we're actually running out of time. So I think I'm going to have the last question on this section to you, Renee. But I would also just like to focus on the second half of this topic, on lifestyle. And, very often we get questions about fatigue and low energy. So Renee, if you could just take us through some strategies that you recommend for supporting patients dealing with low energy or fatigue during treatment, and how can family members play a role in this?
Well, from my perspective, as you can see with Jean, it's a breadth of knowledge with dietetics. So truthfully, if a patient came to me and said something about food or a consumption of food or their lack of consumption, I would refer to dietetics. Just straight off the bat. But in regard to what family members can do in the cases of
sorry, this
fatigue,
is about low energy, just low energy for any reason.
okay, so low energy and fatigue, I often encourage patients to allow themselves some grace and to look at the situation with compassion. Oftentimes I find patient compare their ability with when they were previously diagnosed versus present moment when they do have cancer and are going through treatment. So I look at ways, or I help them to look at ways in which they can adjust what they're doing in a day and to reduce the expectation, but to continue on with as much as can be done in a healthful, happy way. With patients' families or support people, I encourage them to step it up a bit to see what they can do in the way of kind of balancing things off, where a patient might be cooking all their meals for themselves. Perhaps the support person might be able to help, or perhaps the support person might be able to develop a meal train with the patient's support people, right? It's really about kind of looking at where the patient is at from a strengths-based perspective to see what they can and want to do and how to support them with doing that in a reasonable way.
Yes, thank you so much for that. Okay, so we're going into our last section, which is patient advocacy and support. We're also, we have around 5 minutes left in our panel. Time flies. These conversations have been absolutely incredible. So I'm going to give each one of you 1 minute for the next questions that I'm going to pose at you. I'm going to start with you, Dr. McDonald. Could you tell us about how do you foster an environment where patients feel confident to participate in their treatment decisions and care? And Sarah, I'm going to give it to you, the same question to you after as well.
So I don't pretend that I do this well, but I can tell you that what I try to do is be open. All right, I talked before about the importance of asking somebody how they're doing. I think equally important is asking somebody what questions are they bringing to me, right? It's not about me telling you that you're doing well. It's about me finding out from you what is going well and what isn't going well. And I think if we genuinely support that environment that allows a patient to be open with whatever their needs are, then I think that that's the best way to optimize their care.
Thank you. Sarah?
Yeah, I think Dr. McDonald did a really good job of kind of summarizing what I try to do in my own practice. I think people feel the most confident when they feel like they're being heard and that they're being respected. So making sure that our clients have the opportunity to really explore what's going on with them and feeling like their care team values that information and takes it into consideration is super important. I just think it's not possible to be confident and engaged in your care unless you feel like you're part of the team. So I just like patients to make sure that they know that they are the most important member of the care team and that we need their help.
That's that. I completely agree with both of you and what you've said. with respect to involving the patients and having them be part of that discussion and decision-making. Okay, next set of questions goes to both Renee and Jean. Renee, I'll start with you. In your experience, what are the most effective ways for patients to advocate for themselves within the healthcare system, and how can they prepare for conversations with their care team? If you could take us through that.
Sure. I mean, I think Sarah hit the nail on the head a few questions ago. I would encourage the patient, first of all, in the beginning stages of diagnoses, to bring someone with them. Just because it sounds like that Charlie Brown talk when you're first getting information about cancer treatment and diagnosis if you're on your own. So after about the first 5 minutes, it's, the wah kind of situation. So if you can bring someone with you who can write it down, or if you can ask the physician, if you can't bring anybody with you, which that happens, I would ask the physician if they are okay with you recording it. Sometimes they're not, but sometimes they are. And that way that gives you the opportunity to revisit the conversation, because oftentimes, like Sarah was saying, you leave feeling like you don't even know what happened. So then you're confused, and then you're scared, and then all the things that go along with that. As the process moves forward, I like to tell patients to write down their questions before the meeting with the oncologist, just so that when you go there, you're not kind of getting all this information and then forgetting it. You're going there with questions where you can write the answers to, so you feel like you've got a bit of the information that you were wondering about before. And I also think that patients in advocating for their own health, try not to be a hero. If you're not feeling well, or if you're feeling some kind of symptomatic stuff, make sure to discuss it with the MRP. It's okay to discuss if you feel nauseous. We all know that a lot of chemotherapies and radiation can produce nausea, but let them know so that maybe they can produce or provide you with a prescription for a stronger anti-nauseant. And whatever alterations can be made, maybe they can adjust the treatment schedule, whatever can be done. But to be open and honest with the oncologist and the team is probably my top recommendation to each patient.
That's amazing. And just being kind to yourself, I think, is so important there as well. And so, Jean, I'm going to give you the last word. If you could tell us, how patients are most effectively able to advocate for themselves.
I can be super brief here. Just echo what other people said. Write your questions down and bring somebody with you.
Mhm.
And depending on the experience that you've had, if it's I hear let me just say, I hear great things about oncologists. Other areas that I work in, sometimes there's a lot of complaints about the doctor not listening, the doctor not doing the tests they want. And I say, okay, who's the bulldog that and that's part of your support who will speak up, who will, but select the person to come. If you want the person who's the excellent, record keeper, who's just, so choose that person, depending on the needs, and you write your questions down.
That's right. As Mr. Rogers said, find a helper and bring your helper, right? That's incredibly important. Amazing. So when we started this session, I had promised all of you that we would have some incredibly valuable and enriching discussions. And I think I'd like to assume that I lived up to my promise, because our panelists today have just been absolutely incredible. I'm in absolute awe with the wealth of information, the compassion, the generosity of sharing that all of our panelists brought and shared with us today. So thank you to each of you today for joining us for this incredibly important panel that we do year after year, because we know how critical it is for our community. And as always, thank you to our attendees and our wonderful community for joining us here today and for being a part of our annual patient conference as well. So with that, I'm not going to keep you from your next session. Your next session actually builds upon some of the aspects that we touched upon here in our panel. It's going to be on spiritual health and wellness for lymphoma patients. So if I could please encourage all of you to hop off this call and join the next session where we can continue some of this discussion. And again, thank you so much to our 4 panelists today. I am in absolute awe of all of you. Thank you. And thank you for the incredibly important work you all do. Take care. Bye, everyone.